So now we're going to move on to highlight the reason why we need to develop and implement healthy food policies to help mitigate the risks that are associated with non-communicable diseases. So it is my pleasure to now introduce to you Kesaundra Alves from the Global Health Advocacy Incubator, and she will be providing us with the major key healthy food policies and why they are a must for solving some of the issues that have already been shared. Welcome, Kesaundra.
Thank you, Rosanna. Welcome, young people from across the region. I hope you're having a good day. Just allow me to share my screen. Great. So yes, I'm going to talk to you today about, why it is that we need healthy food policies and we need them now. So I want you to look at this child. You see an overweight or possibly obese child. And as a food policy advocate, I don't want you just to see the overweight child. I want you to think about all the things that could have led to this child being overweight. You need to think beyond just what you're seeing in front of you. And there are a number of issues. It could be the environment, as the panelists talked about just now. A number of things come to mind when you look at this child. So it could be, I just want you to open your mind and think about it. Why is this child overweight? Could it be that, let's call him little Johnny, could it be that little Johnny's parents don't have the information they need to make informed food choices for Johnny and possibly even themselves? Is it that there isn't healthy, nutritious food available to Johnny at school or at home, in the environments that he most frequents? What are the school meals contain if schools in your country give school meals to children? Are there vendors around the school selling ultra processed foods and sugar sweetened beverages that lead to obesity and overweight? Are they selling, the Coca-Cola, your Fanta, Chubby, etc.? Are the ultra processed food industry and the sugar sweetened beverage industries engaging in promotional and sponsorship activities at schools across your countries? Are they going to the sports events and making donations of sports drinks? Is KFC going and giving fast food to the kids? You have to look at whether there are marketing and promotional and sponsorship activities going on in the schools that influence children in a particular way. What is little Johnny thinking about when he sees his favorite cartoons and, the cartoon characters are eating tricks and, they really market these products to children. So from the time they could understand language and they start watching cartoons and their favorite shows, the thing about eating fast food and eating cereals and other ultra processed products gets embedded in a child's mind, and it's very hard for them to let go of that. They're highly influenced by all of that. And sometimes it's not even just the brand. Like the other day I was listening, my goddaughter was watching a program on television, a cartoon, and I heard one character telling another that if they completed some challenge, they would get pizza. And the word pizza was mentioned for the next 2 minutes of the cartoon. And when the child completed, the cartoon character completed the challenge, where's my pizza? Where's my pizza? So it's not just about a brand, but these shows are trying to make associations between success and reward with food. So these children are influenced at a very, very early age. So all these factors could lead to little Johnny being overweight. And so as an advocate, you have to think about all these factors. And I know there are these documentaries coming out in the US, for example, where they have unique issues that we don't have in the Caribbean. So there are places in the US, especially in minority communities, where for miles and miles, they can't find a fresh vegetable to buy. There are no supermarkets. There are only these corner shops that sell these sugar sweetened beverages and processed products. People can't find vegetables, and they have high incidence of obesity in those communities. So everywhere will have unique issues that you as an advocate have to pay attention to. right? So talking about little Johnny, the evidence has shown that children are especially vulnerable to diet-related NCDs because they are dependent on others, such as their parents or their schools, for food. They can't get the food themselves. And because they are more susceptible to marketing strategies, as I explained just now. In addition to immediate detrimental effects on children's health, unhealthy diets can have severe health consequences later in life due to early formation of eating habits and preferences. And because childhood NCDs are likely to persist into adulthood, right? So this is a statement from the UN Special Rapporteur on the right to health on the adoption of front of package warning labeling to tackle non-communicable diseases. So you can see from this, everything that your panelists just spoke about, children are more vulnerable, these marketing strategies really affect them. The environment that they're in really affects them. Their access to healthy food will affect them, and they form these eating habits very early in life. And an overweight child, as you will see, I'm sure some people talk about the evidence, an overweight child is likely to become an overweight adult. So what are some of the food policy priorities in the Caribbean? So we want in the Caribbean, 4 main food policy priorities are, as advocates, that we're all fighting for, is front of package warning labels on ultra processed foods, healthy school food environments, restrictions on marketing of unhealthy foods and sugar sweetened beverages, SSBs, to children. And we want taxes on sugar sweetened beverages raised. And the WHO recommends that those taxes should be a minimum of 20%. So those are the 4 main issues in our region. Let's talk a little bit about each one of them. So in terms of the front of package warning labels, you know that these ultra processed foods or products, they contain excessive levels of sugar, sodium, fats, trans fats, saturated fats, and they pose a greater risk for obesity and consequently NCDs. So we need people to know what is in a product when they pick it up. People may not know. I'm sure most people don't know how much sugar is in their Coke, how much fat is in their KFC thigh. We don't know. Even I don't know as an advocate. I know it's bad. It has these things in it, but you don't know how bad it is. And some people don't know that it's bad at all. So it's very important for them to have that information. And that's why we're pushing for front of package warning labels. So you would see like an octagonal warning on the product that says high in sugar or high in sodium, high in trans fat. Or, you need to see something on a product that immediately stands out like, oh, warning, I should stay away from this. And that's what we're fighting for in the Caribbean. And these octagonal warnings are said to be the most effective, and those are the particular warnings that the Caribbean advocates would like to see. So both the WHO and the UN Special Rapporteur that I mentioned earlier on the right to health have encouraged states to take measures to provide accurate, available, easily understandable, transparent, and comprehensible information to enable consumers to make informed choices towards healthy diets. And that's what FOPL does. FOPL promotes health by discouraging consumption of unhealthy foods and beverages, thereby reducing diet-related NCDs risk factors, such as overweight and obesity. So we need to advocate for FOPL laws in the Caribbean. The other one is the healthy school food environment, which I think you understand. So what is the school food environment? So the FAO defines that as the spaces, infrastructure, and conditions inside and around school premises where food is available, obtained, purchased, and or consumed. So it could be the tuck shops, the kiosks, canteens, the food vendors, vending machines. Also taking into account the nutritional content of these foods. The environment also includes all of the information available, promotion, the marketing, the advertising, the branding, the food labels, the packages, promotions, etc., and the pricing of foods and food products. So one of the panelists mentioned earlier that the fast food, the bad foods, the ultra-processed products tend to be cheaper. So pricing too is also a strategy, cheaper than something that is healthy. right? So all of those things you have to take into account when you're looking at the school food environment. So you see the FAO also continues, you have to look at what food environment shape, how accessible, affordable, desirable, and convenient specific foods are. A healthy school food environment allows and encourages the school community to make food choices that are consistent with better diets and improved well-being. So this is why you as advocates, you have to fight for healthy school policies that enable and support children having access to healthy diets and less chance of overweight and obesity and NCDs. Then the third policy has to do with restricting marketing of unhealthy foods to children. And as I gave you the example earlier, you know, the children are bombarded by ads on television, on the radio, on YouTube. You know, there are a lot of kid channels that are very popular with children. Sometimes fat, McDonald's, KFC, etc. They have kids playing with all these branded toys, and these videos are very popular on YouTube. So now in 2022, it's not just your television and your radio, but you have to look at what's happening on the internet. And children are being bombarded with these messages, you know, to brainwash them into wanting to consume these bad, unhealthy foods in the long term. So according to UNICEF, clear evidence shows that unhealthy food marketing is highly persuasive and powerful in influencing children. It creates social norms around food and eating, increases children's preference and consumption for ultra-processed foods, and increases total energy intake, right? So children are very susceptible to being influenced by marketing in media. And as you mentioned before, we want taxes to be raised on sugar sweetened beverages. You know, the higher the price, it discourages purchasing of these beverages. And kudos to Barbados, who recently raised their taxes on sugar sweetened beverages to 20%, which is what WHO recommends. The WHO says that taxation on sugary drinks is an effective intervention to reduce sugar consumption. Evidence shows that a tax on sugary drinks that raises prices by 20% can lead to, raises prices by 20% can lead to a reduction in consumption of around 20%, thus preventing obesity and diabetes. So higher prices, less purchasing, less consumption, lower rates of overweight and obesity. I know that especially applies to children, because when your parents give you the little small piece, it's only to take to school to buy a snack. It's only so much it could buy. So if the sugar sweetened beverage is out of reach in terms of price, and you're not going to have that, you know, you might opt for the bottle of water instead. So why have all these policies? I think the thing that underpins all of this, and we as advocates need to know, is that we're fighting for people's right to health, everyone's right to health, and children's right to health, and to have sustainable development in our region, right? You can't have sustainable development if your population is getting sick early on in life, becoming disabled, at home suffering with diabetes, losing a leg, your labor force is reduced. You know, the health of the region is the wealth of the region. So it's not just a matter of the individual, but this matters to our families, because you don't want a breadwinner to get diabetes. Like, who takes, so that family now has less resources available to it. If it was already a poor family, the cycle of poverty continues. So what we're fighting for is important not just to the individual, but to families, communities, your country, and the region as a whole. It's a development issue, you know? But at the core, we're fighting for the right to health for each of us and for everyone in our community, you know? So, and it's important for you to know as advocates that states have a trifold duty to respect, protect, and fulfill all human rights. So this includes that right to health that we all have. And as advocates, we consider the right to health to be extremely critical, and that is what we're fighting to protect and to promote. So we have articles, two important conventions that most of our countries have ratified that I want you to remember. And the first one is the International Covenant on Economic, Social, and cultural rights. And the right to health is embodied in that convention. And it says that everyone has the right to the enjoyment of the highest attainable standard of physical and mental health. And our countries must take steps for the healthy development of the child and for the prevention, treatment, and control of diseases. This would include NCDs. So we all have this right to health, and all our governments must take steps. And specific things they mention are for the healthy development of the child and for the prevention, treatment, and control of diseases, which would include NCDs. And then we have the Convention on the Rights of the Child, which speaks specifically to the right to health of children, which two of our policy priorities focus specifically on: the school food environment and marketing to children. So there's a right to health, a specific right to health for children, and the state parties who have signed on to this convention, they commit to implementing measures to diminish child mortality and to combat disease and malnutrition, and to ensuring, this one is important, and to ensuring that all segments of society, in particular parents and children, are informed, have access to education, and are supported in the use of basic knowledge of child health and nutrition. So if you look at that last one, you can see how front of package wording labels would be so important, because this convention is saying that we need to give parents and everybody who supports a child the information, arm them with the knowledge and the information that they need to make choices that can ensure the healthy development of the child. And that convention, another important point that the CRC also brings up in Article 17 is that states must pay attention basically to mass media and the influence of mass media on the development of the child, and to take appropriate measures to ensure that the children are not receiving injurious information via mass media. And the marketing of unhealthy foods to children is undeniably injurious to their health. So if you're looking for, when you're talking about a right to health, you can see that the media plays a role, and they need to be a responsible partner in our fight. And then of course you probably have heard about the Sustainable Development Goals and the 2030 Agenda for Sustainable Development Goals. And there's goal number 3, that's very important, SDG 3, which talks about, and we must ensure healthy lives and promote well-being for all at all ages. And this requires states by 2030 to reduce by 1/3 premature mortality from NCDs through prevention and treatment, and promote mental health and well-being. So we also have this goal, a collective goal in the world, to reduce by 1/3 by 2030 premature mortality from non-communicable diseases. So we're all supposed to be working collectively to realize this Sustainable Development Goal number 3. This target on the Sustainable Development Goal number 3. And in our CARICOM region, we have our CARICOM heads of government who held a big summit in 2007 to talk about the state of NCDs in the Caribbean. They were very concerned, and they said that, quote, impelled by a determination to reduce the suffering and burdens caused by NCDs on the citizens of our region, which is one of the worst affected in the Americas, the heads of governments committed to, quote, provide incentives and resources to ensure that our education sectors promote programs aimed at providing healthy school meals and promoting healthy eating, and to support mandating the labeling of foods or such measures as are necessary to indicate their nutritional content. So you see that I'm focusing on the school food environment and focusing on labeling of foods to provide the necessary information. So when you look at our regional commitment by our heads of government, we look at our collective sustainable development goals, the target to reduce premature mortality from NCDs by 1/3 by 2030. We look at our human rights. We look at the overwhelming stats in relation to overweight and obesity. We look at how vulnerable our children are. All of these are the reasons why we fight, for a change, to have a legal and policy framework in our countries that supports access to healthy and nutritious foods for children and adults. So I can talk to you a little bit about laws and policies, what is a law, what is a policy. So there's three branches of government. There's the legislature. You heard someone earlier talk about parliament. So parliament would be your legislature. Then we have the executive. That's all your ministers, your public servants, all the people who do the work, And then we have the judiciary, which is made up of the courts, your magistrates. They're the people who interpret the laws, So everybody has a different role. Members of the executive, as you would know, your ministers and whatnot, they also are part of the legislature. Some of them are. So you have some overlap there, but the judiciary is completely independent and separate. So the laws emanate from your legislature. Policy comes from the executive. So a law, so as you know, something goes to parliament, they make it a law, they sign off on it. If someone breaks this law, there are consequences. They can be taken to court, prosecuted, and there are consequences for breaking that law. The executive is where policy comes from. It's not a law. It really just gives direction to, if it's a school environment, will give direction to the schools as the administration about what food products could be procured, what people can sell on food premises, but there will be no prosecution should someone not comply with that policy. So it's a softer approach.
Hi, Kesaundra, sorry to interject, but we just have about 2 minutes left.
Yes, I'm almost finished. Yes, right? So policies are important. They state what the government's position is. Yes, people should and they do follow policy, but it doesn't come with the teeth of prosecution that laws come with. And sometimes you need those teeth, because if industry doesn't comply, let's say a manufacturer that wants to sell products, there's a law that says that you must have front of package warning labels, but a manufacturer is choosing not to put those warning labels on their product and to sell without. Then though, if there's a law, those products could be confiscated, the company could be fined, you can even prosecute the directors of that company. They can be fined or they can go to jail. So there are harsher consequences, and the reach of the law is very far when it's an actual law, not a policy. But at a minimum, we need policies, and policies are effective. They just lack the teeth that I'm talking about in relation to the court being able to intervene and to prosecute. So I hope that helps. I hope you understand a little bit about the difference between laws and policies, and that you continue to fight for policy priorities in the Caribbean. Thank you.
Awesome, awesome, awesome. Thank you so much for that presentation, Kesaundra. It was quite informative. And I'm pretty sure we all have a better understanding of the need for healthy food policies, the major or critical role they play in helping to shape healthier and food environments across the region, as well as, sorry about that. Yes, Shan, awesome presentation. So yes, so now we have a better grasp, a better understanding, and I'm hoping that you are all paying attention to all those policy priorities that she mentioned, because we'll be needing them for a subsequent activity. It will be our first interactive session. It's a little game, but I will not say anything further on that. So now, before we get to that activity, we are now going to turn over to a discussion between a lawyer and an advocate. And at the same time, I would also like to remind everyone that the Healthy Caribbean Coalition has a tool called the Childhood Obesity Prevention Scorecard that keeps tabs on all the countries in the regions and whether they have implemented policies like the ones Kesaundra made mention to in her presentation. So you feel free to scan the QR code when it's presented on screen. It is definitely an excellent tool, right?